You
Right.
know, Alyssa Milano talked about testing. She was on Chris Cuomo's show, and she said she started to feel sick, and then this happened.
And then it hits me. I feel like there's an elephant sitting on my chest. I feel like my airways are closing in my throat. I just was so achy. My joints hurt. I had confusion. I had sadness. I had like these bouts of crying. And it was a sick like I have never felt before.
And Dr. Caudle, she kept testing negative over and over again. And finally, she tested positive for coronavirus antibodies, thinking, oh my gosh, so it was true. I did have coronavirus. Has the testing gotten any better now?
Well, that's a complicated question, Susan. What I will say is that, I have had that experience with my patients where there have been patients that I have had that I would have bet money, lots of money that they had COVID. They come out with testing. The testing is negative, sometimes even testing twice, testing negative. This is something that as physicians, we know can happen, that even patients that are most certain they have COVID. What we do know is that there are different types of tests, right? The antigen test is one of the more rapid tests. It does have a high false negative rate, which means it is falsely negative 15 to 20% of the time. Of course, the PCR test tends to be a little bit more a lot more sensitive actually, but takes a little bit longer to get back. What we know, Susan, is that tests are not perfect. Tests, just like most things in life, are not 100%. There are a lot of problems with tests, not just sort of the variability in the results and the different tests that we might be using, the variability with those, the manufacturer, whether they've got the emergency use authorization and all of that stuff. But then there's sort of this concept that, it's not 100%. We've got to keep that in mind. We have to do all of our other things, all of our other preventive measures. That's really, really important as we move forward with this.
I think what you said is key in terms of wearing a mask, and we've heard it before, in terms of washing our hands and social distancing, and really assuming that we have it. If you're going outside and you're going to the grocery store, assume you have it and take precautions like you do.
That's exactly right. Yeah, that's exactly what we should be doing. It's the best thing to be doing, and really still keeping up our guard. I know that it's hard, and this has been a long, long road for all of us, but we still have to act just as vigilantly about COVID now as we might have in the beginning. We have to keep that up.
Dr. Jen Caudle, thanks for your take and your expertise. Always good to see you. Thanks.
Thank you.